Okay, everybody, welcome to the show. I'm Dr. Tony DelAngel coming to you with another episode from the Gonstead Unfiltered podcast. Folks, today I want to talk, and we're going to do the next several episodes on PEMF therapy. This has been one of the biggest game changers in my own personal life, and it's something that when you start digging into the research, it shows how powerful this could absolutely be. Now, let me explain something first off before getting into some of the data with PEMF therapy. Number one is this. We have a 98% success rate in our office when patients follow through with our recommendations. Now, we do a lot of different therapies in the office, and so what that means is that we focus on every aspect of the patient's problem. So if there's scar tissue, we have ways to break up the scar tissue. If there's adhesions, we have ways to break up the adhesions. If there's a stability problem, we can focus on the stability. Obviously, we can decrease the pain. But when there's movement problems, we can focus on the movement. And when we looked at this, 98% is great, but it's not good enough because that just tells us that we're missing something. Until we reach 100%, we got to keep working. We got to keep digging. We got to keep figuring out how can we make this better. And so that 2% that we're not helping or that we weren't helping, it came down to this. Metabolic issues like diabetes, overweight, obesity, the combination of all of this. You have neurodegenerative diseases, things like Alzheimer's, dementia, Parkinson's. You had anxiety and depression and some of these issues. And when you see that demographic and you look at them and you study them, they all kind of had the same things that were missing in their body. The number one thing being energy. They didn't have the ability to make energy in their body to the point where their bodies were not healing. So we had to figure out ways to address that issue because we were throwing the kitchen sink at people. If you found yourself going to your medical doctor, your physical therapist, your chiropractor, your massage therapist, the acupuncturist, and nothing seemed to be working, you were just going from one provider to the next, it's because you weren't focusing on the complete picture. All of those therapies are good. The problem is when you use them by themselves, they're only going to be so effective. And when you start combining some of these therapies along with some of the other modalities that we have in our office, all of a sudden you get this compounding effect with a significant improvement in your health or your conditions. And so what we found with PEMF is PEMF was kind of like one of the main players whenever a patient came in and they had all of these different things, whether it was a metabolic issue, a neurodegenerative issue, anxiety, depression, those things, and they weren't improving when we were throwing the kitchen sink at them. We say throwing the kitchen sink. They were doing chiropractic and nephropathy and rehab, and we were doing maybe spinal decompression and all these different things, and they're still not improving. Then we have to kind of take a step back and give them the building blocks to create more energy in their body so their bodies can actually heal. PEMF was a main player, and it showed significant improvement when we started to add this into some of our patients' routines. So I want to talk about this, and the way I'm going to do this is we're going to talk about this basically by condition, because there's so many different things that PEMF can help with. And it's not that it's treating a specific condition, it's doing things to your body so that way your body can actually heal itself. And regardless of the condition that you have, PEMF therapy has shown to be extremely effective when adding this to our care plan. So what is PEMF therapy first off? PEMF is Pulsed Electromagnetic Field therapy. And what it does is it works by using electromagnetic waves to stimulate your body's natural healing processes. So in simple terms, it sends energy into your body's cells, helping them recharge and function better. So there's a lot of different things that it can be worked or used for, and it's extremely versatile in terms of its application. It's not just limited to a specific condition or anything like that. It's been used to help with things like chronic pain, inflammation. It helps restore balance in your body's cells. It improves circulation. It even enhances your sleep if you use it properly. And I got a funny story about that because the first time I used PEMF, I actually have a mat at home that does it. And I tried to lay on it, and I think I went to bed at like 9 o'clock. By 11 o'clock, I was so amped up, I could not sleep because I used the wrong frequency. And so you can actually change the frequency and the intensity of these machines. And when I was using it, my frequency was so high, it's designed to charge your body's cells up. I was so amped up and filled with energy, I couldn't sleep. And so what's funny is the next day, I still, even though I didn't sleep, I didn't feel like I was dragging because I didn't sleep. I was actually filled with energy because PEMF has the power to do that. So I actually had to reduce the frequency and make it really, really low and the intensity really low, and it actually did help your sleep. So you have to be careful with how you use this, and you have to know how to apply it based off of what you're dealing with. But unlike surgical interventions, PEMF therapy is non-invasive. It's completely safe. You can integrate this into your wellness routine with ease. Typically, you either lie on a mat or you put you sandwich yourself in between a blanket if you're using a commercial grade PEMF machine, or you can use these rings and apply them over a specific area if you're having like a local area that you want to focus on. But it's a relatively new procedure, and so research is just constantly coming out, uncovering all these different benefits from chronic pain to joint regeneration to even dealing with cancer. And so, folks, what I'm going to do today is basically explain to you how PEMF works. And we're going to talk about pain because when you come into our office, the majority of people are coming in because they're in pain or they're dealing with joint issues. So we'll start with that, but we're going to get into things like cardiovascular benefits, immune system benefits, dealing with cancer and wound healing. This thing has a number of different benefits that are absolutely amazing. And when you see some of the studies and what they're coming up with, folks, it's a game changer. So think of your body's cells like batteries, okay? And over time, what happens with stress and poor nutrition and injuries and aging, all of these things drain your cells' energy, making them weak and less effective, really at just anything, really, repairing tissues, reducing inflammation. And so over the course of time, we become sluggish. Our batteries run low. Think of it like that, okay? And so PEMF, what it does is it works by recharging those batteries. It recharges your cells, giving your cells the energy that they need to heal, regenerate, and perform functions at an optimal level, okay? So think of your body kind of like a cell phone. And as your cell phone battery drops, PEMF works like a wireless charger where you can put your body on this machine and it charges your body back up so your body can actually function efficiently again. Think of it kind of like that. Now, the way it works, or like the mechanism the way this works, is it sends magnetic pulses into the body, pulses of electromagnetic energy that penetrate deep into your body. And these pulses are completely safe. And they mimic kind of like the natural electromagnetic fields of the earth, okay? So everybody's heard of grounding, and it kind of sort of works like that, but it has a greater intensity than what the earth can provide. And so what happens is your cells will absorb this energy. And every cell in your body has this electrical charge. And so when a cell is damaged, inflamed, or just weak, its voltage drops, kind of like a drained phone battery. So what PEMF will do is it restores the cell's voltage, bringing it back to a healthy state. So every healthy human cell, just so you know, is between negative 20 and 25 millivolts. Just to give you some context, a cancer cell is about plus 30 millivolts. So when you start to lose your negative charge, the cell becomes diseased, it becomes weaker, it becomes inflamed, it becomes very dysfunctional. So you want a negative charge with your cells. In order for your cells to regenerate, your cells need to get to negative 50 millivolts. And PEMF therapy helps you get to that negative 50 millivolts so your bodies can actually regenerate, the cells can regenerate and repair themselves, and then we're back to normal. But when it happens like this, what it does is it stimulates your mitochondria. Those are basically the powerhouses of your cells that create energy. And so there's something called ATP that your cells will create, and that's kind of like the fuel or the energy source that your body runs on. So the more ATP that your body is making, the more energy you're going to have, the faster you're going to heal, the less pain you're going to have, and the more energy you're just going to have throughout the day, so your life is a vibrant, healthy life. And what PEMF does is it charges your cells so they can create more of that ATP. But it also increases blood flow and oxygenation. This is the cool part, because what it does is it causes your blood vessels to expand, okay? And that's going to improve circulation. Every single time you have an injury to your body's going to lay down scar tissue. So it's like when you cut your skin, you're going to scab up, right? And so when you cut something underneath your skin into tissues, it's going to scab up. And when it scabs up, blood flow can't get to that injured tissue because it's blocking the flow of the oxygen and nutrients that are in your blood. And so that can't get to the tissues. And so what PEMF will do is it's going to increase the amount of oxygen, it's going to increase the amount of nutrients and circulation and break through a lot of that scar tissue, so that way it can reach the tissues and speed up the recovery and healing process. I can't tell you how many times I'd had an injury, maybe when I was younger too, and it took maybe 2, 3, sometimes 4 weeks to recover from some type of injury, right? And now that I'm older, even if I use a PEMF machine, I promise it's like a week or 2, and all of a sudden you recover significantly faster. This has been an absolute game changer for really everything in my life. I use it for everything. I use it for sleep, if I have to manage an injury or pain management or just soreness or anything like that. Even just to prep my tissues before a workout, I'll do it, for that. But it's also going to reduce inflammation. It's going to reduce your pain. It lowers inflammation by basically affecting the molecules that trigger swelling and pain. And it also helps flush out a lot of the waste products from damaged cells. So if your body becomes stagnant and you can't flush out this waste material, you're going to have inflammation. You're going to have a lot of pain. PEMF is going to help flush that out. It's going to help increase the circulation. The cool part is we combine a lot of these different things to kind of create this stacking effect, meaning we can have patients do PEMF, and then right after they're going to jump into a hyperbaric chamber where what it does is it unbinds your red blood cells, which help carry oxygen. And once they're unbound, we put you into a hyperbaric chamber. So we're going to load your body up with all that oxygen. And all of a sudden, it's like putting your body on steroids to heal and recover because of all that oxygen that we're putting into the body. Plus, we're increasing the circulation. Now it can circulate throughout the entire body and heal wherever your injuries are. So it's an amazing therapy that we use quite a bit with patients in our office. But the one thing that people don't understand is it actually promotes regeneration and tissue repair. So it's going to help rebuild your bones, cartilage, soft tissues, and it does that by stimulating your stem cells, and it increases collagen production. So if I were to tell you, hey, we have this pill right here, and it's going to increase the number of stem cells in your body, and it's also going to increase the amount of collagen in your body, everybody would jump on it. PEMF is actually going to do the same thing. And this has actually been used now in hospitals to speed up bone fractures and help arthritis in patients. And so we have, I can tell you, I have a patient, and he broke his arm 2 or 3 times. There was a cyst in the arm, and so he broke it several times. And he actually used a PEMF machine to speed up the healing to the point where his doctors were like, how did you heal so fast? And he told them about PEMF, and it made a difference. But let me show you this picture here. This is a before and after picture of a knee joint. And you can see in the before picture how it's close to bone on bone. There's a lot of arthritis in the spacing there. You should see more spacing between the 2 bones, and you're not seeing that. And then this is after PEMF therapy over the course of time. We're looking at about 3 to 4 months of continuous, constant use of PEMF therapy, and you can see the regeneration that happened in the cartilage. So this is a significant thing. This is not something that you do it once and you're going to be miraculously healed. This is done, over the course of time, and this is something that has a compounding effect, meaning that the more that you use it, the more benefits you're going to see from it. Okay, so sometimes patients will go in and they think, hey, you know what? I've done this, 5 or 6 times, and it maybe gave me a little bit of pain relief, but it's not where I want it to be. You have to be patient with PEMF. Whenever you're talking about regenerative issues where you're trying to regenerate cartilage, you're trying to regenerate bone, you're trying to regenerate skin, or whatever the case is, you need the time to help regenerate that tissue, okay? But what does this mean for you? It means faster recovery, okay? So it's going to help any athlete. It's going to help patients who have been injured, especially with the chronic injuries. So if you've been dealing with this chronic pain and it's just not getting better, and you've gone to see every single provider, PEMF therapy is something that you're going to probably want to consider to add into your routine to help speed up your recovery process. It's going to mean less pain, less inflammation, less nerve pain without the use of drugs. There's so many side effects to a lot of these drugs nowadays, and they're becoming addictive. And so this is one of those treatments where it becomes addicting because you do feel good after the treatment, but there's no side effects, okay? You're going to have more energy. It's going to recharge your cells so you actually feel more alive and energetic. And then you're going to have better circulation, meaning it's going to increase blood flow and oxygen delivery, so your cells and your tissues are actually going to recover faster. But PEMF therapy is also going to provide stronger bones, stronger tissues. That's going to help with things like arthritis and osteoporosis and many injuries. But again, a 98% success rate. When we started adding PEMF to those patients, that 2% that weren't recovering from like your physical therapies and your chiropractic and naturopathy and all these mechanical types of treatments, and you looked at that demographic, they were lacking the building blocks in their bodies to produce more energy. So we started giving them things like PEMF or the hyperbaric oxygen or red light therapy, and those types of procedures are designed to increase your body's ability to make energy, and all of a sudden the body starts to recover. So imagine your cells being kind of like cell phones, and when your battery dies, your phone doesn't work. And PEMF is going to act like that wireless charger for your body. It's going to recharge your cells so that way they can actually function again at full power. Now, I want to go over some of these studies that we have found with PEMF therapy. They were actually using this for improved cartilage growth with astronauts and NASA. So NASA was actually doing some studies, and what they found is that it was helping things like osteoarthritis, joint injuries, and degenerative diseases. And what it did is it helped provide improved joint mobility, pain relief, but it regenerated cartilage. It stimulated the growth of healthy cartilage. I cannot tell you how powerful that is. There's very few things out there. People are spending tens of thousands of dollars on things like stem cell therapy to try to improve cartilage regeneration. And while that is good, PEMF therapy is something where you don't need to inject you with anything like that. You can just use this electromagnetic field to help regenerate the cartilage cells in your body. It's going to help rebuild cartilage. Here's another study on PEMF and back pain. And what they did is they followed 50 people with chronic, debilitating low back pain from May of 2015 to September of 2016. And what they did is they combined one group with physical therapy and PEMF, and then the second group was physical therapy and a sham type of PEMF, meaning that there was no electromagnetic frequency. The patient didn't know about it. It was just kind of like a sham treatment. And what they found was that the group that received physical therapy and PEMF had significantly less pain, less disability, and had better low back movement in all directions, meaning like forward, backwards, side to side, and rotation compared to the control group. So what they found is that regular physical therapy resulted in superior movements and pain relief, daily function, and back movements. But if they added PEMF therapy, it cut the amount of physical therapy in half and to get to where the patient wanted to get to. Now, if you're an athlete, I highly suggest you use this. And so they found another study, because athletes are constantly training. Even if you're a patient and you go through some of your exercises and you're just really sore, that soreness is called delayed onset muscle soreness. Okay. And with this, they did another study and they measured people at 24, 48, and 72 hours. And overall, what they found was that PEMF therapy was effective at reducing DOMS, or delayed onset muscle soreness, improved recovery from perceived muscle soreness, and it happened significantly faster compared to a group that didn't use PEMF therapy. So in other words, if you're sore after working out or doing your rehab exercises, PEMF therapy is going to cut that significantly down so you're not suffering after a tough workout. And for those of you who are dealing with knee arthritis or knee osteoarthritis, they studied 60 patients who were doing group exercise alone, or they were doing exercise plus PEMF therapy, and they did this for 8 weeks. And what they found was that the PEMF group had significant improvements in muscle strength around the knee, including knee extension and knee flexion at both the affected knee and the other knee compared to the control group. Okay, so again, this is something where it decreased their pain, it improved their muscle strength around the knee, and for some reason they found that female patients showed greater improvements in muscle strength, while male patients experienced more pain relief. But what they found was that regardless of the gender, patients over the age of 70 showed superior improvement in muscle strength and pain. And so this is something, especially as we age, for all of you patients out there and you're dealing with arthritis, PEMF therapy could be a fantastic procedure for you to do, not only to help with your pain, but to help improve the strength around your joints as well as help regenerate the cartilage. Now, here's another one for rheumatoid arthritis. Again, what they found was that the study suggests that PEMF therapy helps slow rheumatoid arthritis progression by protecting joint tissues and reducing inflammation. And so they're highly recommending that anybody who has rheumatoid arthritis and they're taking medication for it, this is something that they can use as a complementary therapy to all that to help slow down the effects of rheumatoid arthritis, as well as help prevent the eroding of cartilage and bone, which rheumatoid arthritis is known for. Now, again, I'm going to go back to you athletes here, because when it comes to muscle readiness and responsiveness to exercise and training and your sport, what they did with a bunch of athletes is they took a PEMF machine and they did it before practice, they did it before workouts, they did it before their game. And what they found was that PEMF stimulation, there was a noticeable increase in muscle activity in the initial warm-up phase of working out. There was an increase in muscle activity before the game. And so if you're increasing muscle activity pre-game, pre-workout, what happens is that shows like muscles were responding faster, muscles were contracting faster. If you want a cheat code for your sport, especially if you're in some type of sport that requires either high explosive movements or endurance, PEMF before your game or your session or your workout is highly recommended, because they're showing that it was an increase in glucose by your muscles that caused this increase in muscle readiness. And so the more ready your muscles are, the less chances of injury you're going to have, the more explosive you will be. And I thought that was a pretty cool thing. Now, here's the one that blew my mind. They did two different studies here. One was done over the course of 15 months. And what they actually did this on guinea pigs with daily PEMF therapy. And what they found was that it actually, number one, it slowed down significantly the progression of osteoarthritis, but two, it actually regenerated the cartilage in the knees, and they showed an increase in spacing between the knees in this one study. The second study was pretty similar. They also did that on guinea pigs for 21 months. And what they did is during this time, they actually did 6 hours of PEMF therapy per day. That's quite a bit every single day. But what they found was that it prevented cartilage thinning and actually improved the spacing or the thickness of the cartilage. And in severe osteoarthritis, the different types of frequencies that they used decreased the pain significantly and improved the spacing between the joints. So again, it's not just a treatment, folks. It's a cellular tune-up, if you will, helping your body do what it's designed to do and heal itself. Again, if there's a way that we can decrease pain, decrease inflammation, improve blood flow, increase the amount of oxygen going through your blood and to your tissue so they can heal faster and help regenerate bone and cartilage, then we're going to find ways to do it. And PEMF therapy has proven to do all of that. And we're just talking about pain for right now. So, folks, if you're struggling with pain, if you're struggling with joint problems, I highly recommend you consider PEMF if you're not already doing it, especially in our office. We add this as a complementary therapy for patients who are dealing with a lot of these issues. But if you've been everywhere and it just seems like you're not recovering or not recovering fully, or you still have pain and you're not seeing results, give us a call at any time and we can talk to you about PEMF therapy, how it works, and how we can add it to your care plan or your program to help get you past that hump so that way you can actually enjoy the life that you're looking for. So, folks, I hope you enjoyed this episode. If you have any questions on PEMF therapy and pain, always feel free to reach out to us at any time. But until next time, folks, we'll see you then.